Welcome to This Week in Endocrinology. This week we're covering 10 notable papers spanning advances in type 1 diabetes care, evolving diagnostic paradigms in adrenal and pituitary disorders, and the long-term systemic consequences of endocrine diseases. Let's dive in. We begin this week with a deeper look at type 1 diabetes management, where 3 new studies challenge our assumptions about insulin choices, glucose metrics, and patient perception. In the Lancet Diabetes and Endocrinology, researchers published the Human 1 trial, which evaluated whether switching from human intermediate-acting insulin to insulin glargine improves glycemic outcomes for children and young adults with type 1 diabetes in low- and middle-income countries, specifically Bangladesh and Tanzania. Surprisingly, the randomized trial found no significant difference between the glargine and usual care groups in either the time spent in very low range or the time spent in the target glycemic range after 6 months. This suggests that in resource-limited settings, access to analog insulin alone may not translate to immediate glycemic benefits without broader system-level support. Meanwhile, in high-resource settings where advanced diabetes technology is common, a retrospective analysis in diabetes care evaluated over 1,300 adults to see how fear of hypoglycemia relates to actual continuous glucose monitoring metrics. The investigators found that patients' fear and their perceived frequency of hypoglycemia did not correlate with their actual time spent in hypoglycemia. This indicates that psychological distress and fear of lows are driven by factors beyond a patient's objective glycemic profile, highlighting the need for dedicated psychosocial support. Further complicating how we view glycemic metrics, another study in diabetes care explored how chronic hyperglycemia shifts a patient's physiological comfort zone. By comparing the standard clinical time in range with a personalized, time in personal range, defined as 50 milligrams per deciliter above or below a patient's mean glucose, the researchers discovered that patients felt physically and cognitively better when their glucose was within their personal, often higher range. While standard clinical targets were associated with better self-care evaluations, the personal range explained unique differences in daily symptoms like fatigue and cognitive processing speed, suggesting that clinicians should consider a patient's habituation to higher glucose levels when customizing glycemic targets. Next, we turn to diagnostic innovations in pituitary and adrenal disorders, where advances in imaging and laboratory assays are simplifying complex diagnostic workups. For decades, bilateral inferior petrosal sinus sampling has been the gold standard for distinguishing Cushing's disease from ectopic ACTH syndrome. However, a retrospective study over a 30-year period, the clinical use of petrosal sinus sampling fell from 68% to just 26%, while the detection of typical adenomas on magnetic resonance imaging increased from 40% to 69%. Crucially, the accuracy of Cushing's disease diagnoses remained stable throughout this transition, confirming that high-quality modern imaging allows clinicians to safely reduce invasive testing. In a similar vein of simplifying diagnostics, a study in the European Journal of Endocrinology validated a machine learning model designed to distinguish non-classical 21-hydroxylase deficiency from polycystic ovary syndrome. Using basal serum steroid profiling via liquid chromatography mass spectrometry, the 20-steroid model achieved 100% diagnostic accuracy in 2 independent validation cohorts. This machine learning-driven approach could eventually eliminate the need for invasive, time-consuming cosintropin stimulation tests in hyperandrogenic women. For younger patients, another publication in the European Journal of Endocrinology presents the first international consensus on the diagnostic workup of pediatric adrenocortical tumors. Utilizing a modified Delphi process with global experts, the consensus establishes 41 standardized statements spanning clinical assessment, endocrine workup, imaging, and genetics, aiming to reduce the wide variations in care currently seen across different global centers. Finally, we examined several new papers addressing the long-term systemic risks and reproductive implications of endocrine conditions. In the European Journal of Endocrinology, a Danish nationwide cohort study, with up to 44 years of follow-up, evaluated cancer risk in over 800 patients with biochemically validated acromegaly. While overall cancer risk and cancer-specific mortality were not elevated compared to matched controls, acromegaly patients experienced a nearly doubled risk of colorectal cancer. and a more than threefold risk of thyroid cancer. They also had a significantly higher incidence of benign colorectal lesions, such as tubular adenomas, reinforcing the clinical importance of vigilant endoscopic screening in this population. In reproductive endocrinology, a concerning safety signal was raised by a cohort study in the Journal of Clinical Endocrinology and Metabolism regarding the offspring of women undergoing fertility workups. Researchers found that school-aged children conceived within 6 months of a maternal hysterosalpingography using iodinated contrast had a lower mean intelligence quotient and poorer attention control compared to controls. This neurodevelopmental deficit is thought to stem from transient maternal and fetal thyroid disruption caused by the Wolff-Chaikoff effect. Notably, children conceived more than 12 weeks after the procedure showed no such deficits, suggesting that a cooling-off period after iodinated contrast exposure might protect fetal neurodevelopment. For couples experiencing fertility issues, a prospective study of 800 men in the same journal demonstrates how a comprehensive, endocrine-integrated diagnostic protocol can revolutionize male factor infertility management. By combining semen analysis with testicular ultrasound and hormone profiling, investigators reduced the proportion of patients labeled with idiopathic infertility to just over 5%, with primary spermatogenic failure emerging as the dominant, high follicle-stimulating hormone phenotype. Lastly, a systematic review and meta-analysis in the Journal of Clinical Endocrinology and Metabolism quantifies the profound autoimmune susceptibility associated with Klinefelter syndrome. Men with an extra X chromosome had a massive, more than 20-fold increase in overall autoimmune susceptibility, which rose to a nearly 50-fold increased risk for clinically manifest, interferon-associated diseases like systemic lupus erythematosus and autoimmune thyroid disease, underscoring the powerful role of sex chromosome dosage in immune regulation. If you only have time for one paper this week, make it the long-term cohort study on cancer risk in acromegaly. This landmark study provides crucial 44-year follow-up data that clarifies the specific elevated risks of colorectal and thyroid malignancies, offering a strong evidence-based justification for long-term endoscopic and endocrine surveillance in our acromegaly patients. Here are the key takeaways from this week in endocrinology. First, analog basal insulin like glargine does not automatically improve time in range or reduce hypoglycemia compared to human insulin for young patients with type 1 diabetes in resource-limited settings, highlighting the need for comprehensive diabetes care infrastructure. Second, patients' fear and perception of hypoglycemia do not correlate with objective continuous glucose monitoring metrics, and their physical comfort may align more closely with a higher, personalized glucose range than standard clinical targets. Third, modern high-resolution magnetic resonance imaging has safely reduced the need for invasive petrosal sinus sampling in Cushing's disease diagnostics without sacrificing diagnostic accuracy. Fourth, children conceived within 12 weeks of a maternal hysterosalpingography using iodinated contrast may face a transient risk of lower intelligence quotient and attention deficits, suggesting a potential clinical benefit in delaying conception attempts immediately after contrast exposure. Finally, a comprehensive diagnostic workup, including hormones and testicular ultrasound, can identify a specific pathology in over 94% of men with suspected infertility, virtually eliminating the idiopathic label. That's your roundup for this week in endocrinology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.